Hello, I am Seth Jones, one of the internal medicine residents here at Northeastern Health in Tahlequah, presenting poster 38, our simulation-based ultrasound curriculum to improve internal medicine residents' point of care ultrasound proficiency and confidence. For our background for this project, we do know that utilization of point of care ultrasound improves patient outcomes overall, um, and allows for better identification of pathology within our patients. The project here is limited for our cardiac views, but our ultrasound proficiency itself can be expanded easily into other organ systems. Additionally, we do note that our structure and function are interrelated, so our evaluation of the structures within the body gives us a better understanding of the function within the body and then allowing us to better treat our patients in the acute setting. For this project, our aim was to increase resident self-reported confidence and then increasing their proficiency with obtaining ultrasound views for the various cardiac windows. The way that we designed this project is we had a pre-intervention evaluation, which is our first graph up at the top, showing how well our residents are able to obtain our views the first try, and then how well they're able to identify the identified structures within the views so that they know what they're looking at. The other method, the other thing that we tracked is the time to view. So how long did it take for each resident to obtain these specific views? Our intervention was a structured um, Cleveland Clinic ultrasound echocardiogram basics simulation curriculum, and that was provided to the residents, and they completed that on their own time. And then within a month after completing that curriculum, they went back and completed the same assessment within the ultrasound simulator in order to show how well they were able to improve both their time to cardiac views as well as their accuracy with identification of structures. And the difference between the two can be seen comparing the two graphs of our first two results. And then for more direct comparison, our third graph here showing the difference between correctly identified percentage and then average time per view. And so you can see our outliers on the middle and right of the screen show that while there is still a significant amount of time required for obtaining views, the accuracy has improved significantly. And then on the left side, we do have an increased number of views that take less time as well. The other thing that we wanted to track is how confident the residents felt, because we do know that as confidence in skills improves, then people are more likely to utilize them. And so tracking the motivation for the interventions and then also the confidence. For our PGY1s, their self-reported confidence initially was low to moderate, and then our PGY2s and 3s were moderate to high. And after the intervention, after the training, after doing the pre and post intervention simulation tests, our confidence overall did increase. So our PGY1s transitioned to mostly somewhat confident, and then our PGY2s and 3s transitioning from moderate confidence to predominantly confident, which is very encouraging. For the efficiency overall, tracking our percent improvement in percent correct the first try as a function of the difference in time per view did show a significant improvement. So our PGY1s had a dramatic improvement in the amount of time to obtain their views, as well as a modest increase in the accuracy. So the combination of the two for an overall efficiency did show an increase of 122% increase in overall efficiency, tracking the percent correct as a function of time, which is very encouraging. And then overall for the entire residency, had an overall increase of 81% of efficiency with the combination of the two tracking numbers. For the conclusions for this project, we did show that the residents developed much more significant confidence in the ultrasound use as a result, as well as increased proficiency with obtaining cardiac views. The hope for the future of this project is that as residents increase in proficiency, they're going to be utilizing it more in their day-to-day use. Additionally, proficiency with the ultrasound machine itself will expand farther than just the cardiac views, and it'll be much easier for them to learn the other systems that they can utilize for evaluation, especially abdominal and pulmonary systems. Those not included in this project itself in order to maintain a narrow scope, but that is the hope going forward. As far as limitations for this, the ultrasound assessments, both pre and post assessments, were not proctored. They were self assessment, but the results themselves are objective and tracked by the machine themselves. And in a similar way, the intervention of the Cleveland Clinic curriculum was a self paced curriculum and not proctored. And that can be a limitation in application to other residencies that may have less motivated individuals. For um, further development of the ultrasound curriculum, repetition of structured and measured outcomes for the different systems does not seem to be an ideal uh, environment to develop resident confidence and proficiency, but rather a intra-resident development and continuing education on their own, especially if we have specific faculty mentors that champion and develop the resident skills, and then also co-residents and senior residents who push all of us forward and develop our skills and encourage our utilization in the future. It's much more effective than repetition of this project. Overall, um, this is a very successful project from our side, improving confidence, improving proficiency, um, and then, of course, our increased management options as a result of having increased data, allowing for our ongoing rational treatment is always very effective and very helpful. So that is this project. Thank you so much for your time.